Well, the CDC says that outbreaks of norovirus, often known as the stomach flu, are up this season, especially here in California. Joining me now is Dr. Neha Narula from Stanford Health Care. So, doctor, thanks for joining us. So I guess the big question is, why are cases spiking?
Indeed, Ryan. Good morning, and thank you for having me. The norovirus is a highly contagious virus that it's been around for ages, and we see up to 20 million cases globally every year. And typically in the Northern Hemisphere, it's very common to see some of these outbreaks happen throughout the year, but generally, most of them occur anywhere from November all the way to April. Now, with the coronavirus pandemic, we did see a change in the natural cycles of many different viruses, including norovirus, RSV, and influenza, even those that we spoke about earlier in the year. Now, add on top of that, we had our lockdowns, we had social distancing, mask mandates, as well as a special focus on hand hygiene and wiping down contaminated surfaces. So that also impacted the patterns of viruses like the norovirus. And now in the last 6-7 months, we've seen mask mandates drop off, offices reopening, and then people in general are more out and about as they should be, right? We're eating out more often, we're socializing, and this itself provides ample opportunities for viruses like the norovirus to sprout up again. And that is why we're seeing such an uptick in cases recently. It's not completely unexpected, but it is different from the last couple of years, and that's why we have so much more of a focus now on the norovirus itself.
So what are the specific symptoms we should be looking out for, and how can you tell those apart from symptoms of COVID and the flu? A lot of people get confused, like, which one do I have?
Absolutely. We typically call norovirus the stomach flu, but it is very different from COVID and flu in the sense that it does not affect the respiratory symptoms or system as much as COVID and the influenza virus does. It is a gastrointestinal virus. It causes gastroenteritis, meaning inflammation of the stomach and the intestines. So a lot of the symptoms that we see with COVID and flu, like congestion, cough, sore throat, we don't actually see with norovirus. We see more abdominal pain, cramping, nausea, vomiting, and diarrhea. And generally speaking, the symptoms are mild and self-limited, meaning they'll typically resolve within 1 to 3 days for majority of the people. We tend to worry more about our young ones as well as our elderly people and immunocompromised people that are at risk for dehydrations with, the loss of fluid through vomiting and diarrhea. But generally speaking, most people do fairly well and don't need any specific treatments. Hydration is key, though, for everyone, making sure you're sipping on water and fluids during your infected period.
Okay, so how does norovirus spread, and what steps should we take to protect ourselves? You talk about everyone's going out more. I mean, should we stay at home now?
Great question. So it's transmitted through several different ways. One, through direct contact with an infected person, but then also through contaminated food, water, as well as contaminated surfaces. So typically, the best thing to prevent a norovirus infection is to practice good and frequent hand hygiene, especially if you have just used a bathroom, if you have a little one at home and you're changing diapers, or if you're handling or eating food. So making sure that you're getting back in the habit of practicing good hand hygiene, and specifically with soap and water. Hand sanitizers don't work as well for the specific virus. In addition to that, if you are grocery shopping and you're bringing home fresh fruits and vegetables, making sure you're washing them thoroughly, wiping down commonly touched surfaces, not sharing utensils. And then if you are unfortunately sick with these symptoms and you've been vomiting or you have some looser stools that gets on your clothes, make sure you wash your clothes thoroughly. And the most important take-home point is if you are sick, or if your loved one is sick, or if your child is sick, stay home. We see outbreaks when an infected individual comes in contact with a lot of people, which is why we're seeing school closings. There was a school not too long ago that had to shut down because over 100 students and staff members got ill with norovirus. So if you're sick, stay home, keep your loved ones at home. It is extremely contagious, but doing the basics of hand hygiene, wiping down surfaces, that will all keep you nice and safe and healthy.
Well, always good advice from you. So Dr. Neha Narula, thank you very much for joining us from Stanford Health Care.
Thank you, Ryan. Have a great rest of your day.